Have you ever experienced a sudden, sharp pain in your stomach, perhaps accompanied by a feeling of weakness, and wondered just how serious such a condition could be? It is natural to be concerned when your body sends strong warning signals, especially when it involves internal issues. The direct answer is yes. A bleeding stomach ulcer can indeed be fatal if not promptly and appropriately treated. While this sounds serious, it is crucial to understand that, with modern medical advancements and immediate care, many of the life-threatening complications associated with a bleeding ulcer can be successfully managed. The reason a bleeding stomach ulcer can be so dangerous lies in its potential for significant internal blood loss. Ulcers are open sores that develop on the lining of your stomach, small intestine, or esophagus. When an ulcer erodes into a blood vessel, it can cause bleeding. The severity depends on the size of the vessel affected and the rate of blood loss. Extensive bleeding can lead to severe anemia, shock, and even organ failure if not stopped quickly. In some cases, the ulcer can perforate or create a hole through the stomach wall, leading to a dangerous infection in the abdominal cavity called peritonitis. If you suspect you have a bleeding ulcer, perhaps from symptoms like black, tarry stools, vomiting blood that looks like coffee grounds, or feeling dizzy and very weak, it is essential to seek emergency medical attention right away. Do not try to self-diagnose or wait for symptoms to worsen. Medical professionals can quickly assess the situation through procedures like an endoscopy, which involves inserting a thin, flexible tube with a camera down your throat to view and often treat the bleeding directly. One important insider detail to remember is that certain medications, particularly nonsteroidal anti-inflammatory drugs, or NSAIDs, can significantly increase the risk of ulcers and their bleeding complications. These include common pain relievers like ibuprofen and naproxen. Always discuss your medication use with your doctor, especially if you have a history of ulcers. Additionally, the presence of Helicobacter pylori, or H. pylori bacteria, is another primary cause of ulcers, and treating this infection can prevent future bleeding episodes. Understanding the potential severity of a bleeding stomach ulcer, coupled with knowing the critical signs to look for and when to seek immediate medical help, empowers you to take control of your health. While the thought of a bleeding ulcer can be frightening, being informed and acting quickly significantly increases the likelihood of a positive outcome and helps ensure your well-being.